Hello, welcome back. In our last video, we talked about the signs and symptoms of depression, and we hope it gave you some insights into what to look out for. But today, we're taking it a step further and delving into what causes depression. If you're curious about what leads to depression, you're in the right place. This week, we're going to explore some of the factors that contribute to this common mental health disorder. It's an important topic because understanding the root causes of depression can help us find ways to prevent, manage, and treat it effectively. We'll be talking about the biological, environmental, and psychological factors that can all play a role in the development of depression. By the end of this video, you'll have a deeper understanding of what causes depression and how you or someone you know can seek help if needed. So stay tuned and get ready to learn more about depression and its causes. We hope this week's content will be informative and helpful to you. All information presented to you in this video regarding the causes of depression are meant for educational purposes only and should not be used to diagnose yourself or others. If you think you or someone you know is struggling with depression, please seek professional help right away. If you live in the US, you may call SAMHSA's free hotline 24/7 at 1-800-662-4357 or text 988 for help. Biological factors. Let's start with the basics. Our brain is responsible for controlling our emotions, thoughts, and behaviors, and it does so by using chemicals called neurotransmitters. These neurotransmitters are like messengers that travel between the brain cells, or neurons, and help them communicate with each other. One of the key neurotransmitters that is often associated with depression is serotonin. Serotonin helps regulate our mood, appetite, and sleep, among other things. When our brain doesn't produce enough serotonin, or when the receptors in our brain that respond to serotonin don't work properly, it can lead to symptoms of depression. Another neurotransmitter that is often involved in depression is norepinephrine. It helps regulate our stress response and our ability to concentrate. When levels of norepinephrine are imbalanced, it can lead to feelings of sadness, hopelessness, and difficulty concentrating. Dopamine is another neurotransmitter that is sometimes associated with depression. Dopamine helps regulate our motivation and pleasure centers. When levels of dopamine are imbalanced, it can lead to a lack of motivation, decreased pleasure in activities that were previously enjoyable, and other symptoms of depression. So when there is an imbalance in these neurotransmitters, it can lead to symptoms of depression, but it's not always clear why these imbalances occur. It could be due to genetic factors, environmental factors, or a combination of both. Researchers are still trying to understand the complex interplay between these different factors and how they contribute to depression. It's also worth noting that depression is not just a chemical imbalance in the brain. There are many other factors that contribute to depression, such as psychological and social factors. But understanding the role of neurotransmitters in depression is an important piece of the puzzle. Genetics. It can be a bit overwhelming to talk about the genetic factors that can cause depression. To make it easier to understand, I'll break it down into simpler terms and explain it in a way that's easy to follow. So let's start with genes. Genes are segments of DNA that carry instructions for making proteins, which help to build and maintain our bodies. Some genes can also influence our susceptibility to certain conditions, including depression. When it comes to depression, genes can contribute to it by changing levels of neurotransmitters in the brain. In fact, some genes can affect how these neurotransmitters are produced, transported, or broken down, which can increase the risk of depression. Additionally, genes can also influence how someone responds to stress. We all experience stress, but some people are more sensitive to it than others. Some genes can affect how the brain responds to stress and make someone more prone to depression if they experience a traumatic life event or chronic stress. But it's important to remember that genes are not the only factor that contribute to depression. Environmental and psychological factors also play a role, and it's usually a combination of these factors that can lead to depression. If you're concerned about your risk of developing depression or have a family history of the condition, it's always a good idea to talk to a doctor or a mental health professional. They can provide guidance and support to help you understand your risk factors and recommend the best course of action to take care of your mental health. Now that you know a little bit about genetics behind depression, here's a statistic that truly demonstrates the impact of genetics on depression. Did you know that people with a family history of depression are 1.5 to 3 times more likely to develop the condition themselves compared to those without a family history? Environmental factors. Now that we've talked about how genetics can impact our risk of developing depression, Let's switch gears and talk about how our environment can also play a role. It's not just about the genes we inherit from our parents, but also the experiences we have in life that can affect our mental health. So let's dive into some of the environmental factors that can contribute to depression and how we can manage them. Environmental factors can play a significant role in the development of depression. Stressful life events such as the death of a loved one or job loss can increase the risk of depression. Childhood experiences, such as abuse or neglect, can also increase the risk of depression later in life. Social factors like social isolation, lack of social support, and loneliness can also contribute to depression. Lifestyle factors such as poor sleep, lack of exercise, and unhealthy eating habits can also play a role. Substance abuse, including alcohol or drug abuse, can also increase the risk of depression. Although not everyone who experiences these factors will develop depression, being aware of them can help us take steps to manage our mental health and reduce the risk of depression. Medical factors. Did you know that certain medical conditions can increase the risk of developing depression? Hormonal imbalances such as those that occur during menopause or thyroid disorders can make us more susceptible to depression. Chronic pain conditions like arthritis and fibromyalgia can also put us at risk of developing depression, as can living with chronic illnesses like diabetes or heart disease. Even neurological conditions like Parkinson's disease or multiple sclerosis can have an impact on our mental health. Certain medications, such as some types of birth control or beta blockers, can also increase the risk of depression as a side effect. It's not just physical symptoms that we need to watch out for when dealing with medical conditions. Our mental health is also important. If you're living with any of these medical conditions and are experiencing symptoms of depression, be sure to talk to your healthcare provider or your mental health professional about your options for treatment and support. Substance abuse. Substance abuse can contribute to the development of depression in a few different ways. In fact, according to the Substance Abuse and Mental Health Services Administration, adults with a substance use disorder are 3 times more likely to experience depression compared to adults without a substance use disorder. First, some substances can directly affect the brain and disrupt the balances of chemicals that regulate mood, such as dopamine and serotonin. This can lead to feelings of sadness, hopelessness, and despair, all classic symptoms of depression. Second, substance abuse can also lead to a range of negative consequences, such as relationship problems, legal issues, and financial stress. These stressors can all contribute to feelings of sadness and depression. Third, substance abuse can also interfere with our ability to manage our emotions effectively, which can make it more difficult to cope with stress and negative experiences. This can in turn increase our risk of developing depression. It's important to note that substance abuse and depression can create a vicious cycle. Substance abuse can make depression worse, and depression can make substance abuse more likely as a way of coping with negative feelings. If you or someone you know is struggling with substance abuse and depression, it's important to seek help from a healthcare professional or a mental health provider. Although depression can be a challenging condition to live with, it's important to remember that there are many effective treatments and interventions available. Whether it's therapy, medication, lifestyle changes, or a combination of these approaches, there is hope for recovery and a brighter future. With the right support and resources, many people with depression are able to successfully manage their symptoms and lead fulfilling, meaningful lives. As we come to the end of this week's video, I want to express my sincere gratitude to all of you for joining us on this journey towards better mental health. Your interest and engagement with our content is truly appreciated, and it inspires us to continue creating more informative and impactful videos. With that, let's get the conversation started. How have you or someone you know been affected by depression? Share your story with us in the comment section. We love reading your comments and learning more about your personal stories. Remember, mental health is a crucial aspect of our overall well-being, and it's important to prioritize our self-care and seek help when we need it. So please, share this video with your loved ones and hit the subscribe button if you haven't already to stay updated on our future content. And if you found this video helpful, don't forget to give it a thumbs up. As we wrap up, I encourage you to spread loving kindness to all beings around you. Thank you for watching, and we'll see you in the next video.